Welcome, and thank you for joining us today for St. Ben's at Home over the noon hour. My name is Marcia Malum, and I'm the Director of Alumni Relations and a St. Ben's alumna from the class of 1996. I'd like to begin our time together today by sharing our land acknowledgement. Both the College of St. Benedict and St. John's University occupy the original homelands of the Dakota and Anishinaabe peoples. We honor, respect, and acknowledge the Indigenous peoples forcibly removed from this territory, whose connection remains today. St. Benedict's Monastery and St. John's Abbey previously operated boarding schools for Native children. Now, students, faculty, and staff are working to repair relationships with our Native Nation neighbors. Thank you. Toward the end of today's episode, there will be time for questions. So if you have anything that you would like to ask Carie, please click the Ask a Question button at the bottom of your screen to submit one. Please note you may need to exit out of full screen view to use the Ask a Question button. Today's session is being recorded and will be posted on our Alum Learning Consortium's past event recordings page in the next 1 to 2 business days. Now, please welcome our moderator, Heather Piper Olson, Vice President of Institutional Advancement.
Welcome, everyone, and thank you for joining us for St. Ben's at Home. I'm so glad you've all taken an hour out of your lives to join us for another wonderful topic and conversation. Grab your lunch or a snack and settle in for a delightful deep dive into one of our very special departments here. He's Chief Nursing Officer about the past, present, and future of nursing at St. Ben's. Welcome, Carie.
Thank you, Heather. It's nice to be here.
We're so excited to have you here. So how are you doing today?
I'm doing great.
Where are we in the end of, or where are we kind of in the cycle of the semester?
So today is the first day of finals. So I just came from the main building where there is a group of dutiful junior students completing their med-surg finals. So I'm sure they all did wonderful.
I'm sure they did as well. And we've had plenty of snow to keep them in their rooms studying diligently these last few weeks, for sure.
Nature's focus.
That's Brian Brees always says that, for sure. So let's start a little bit by giving the audience a chance to learn a little bit about you. So tell us about yourself, how long you've been here at St. Ben's, and what roles you've had in the department.
Well, I was a student at St. Ben's. So I came to the colleges in 1988 and graduated in 1992. And I actually 6 years later came back to start teaching at the colleges. So in the meantime, after I graduated, I worked at the St. Cloud Hospital in the float pool. And then I did that for about a year. And then I went into public health. So I was working at Stearns County Public Health. When I think back to this, I'm like, wow, how did all that happen in such a short amount of time?
I was just about to ask you the same thing.
Yeah. But then after working in public health, I decided to go back and get my master's. So I went to the University of Minnesota and I did their pediatric nurse practitioner program. After I graduated as a pediatric nurse practitioner, I was working at Teenage Medical, which is the teen clinic that's affiliated with Children's in Minneapolis. And during that time, I was commuting. That was a challenge. And saw there was a position open at St. Ben's. And so when I think back, like what I always wanted to do as a kid, I thought I wanted to be a nurse, a doctor, or a teacher. And I feel like kind of at St. Ben's, I get to do all three. So I came back to St. Ben's then in 1998 and started teaching full time.
You were a baby teacher. For
I know.
Sure.
I know.
Incredible.
Yeah, for those that are doing their math, that was 27 years ago. This is my 27th year of teaching here. So I've been the chair of the department. I was the chair from 2009 to 2015, during which we worked together a little bit during that time to fundraise for a major renovation of our simulation lab. And we did that renovation in 2016. I had a sabbatical at that time. And then I was teaching full time. I helped with the development of the graduate program. And I know we'll get to talk about that a little bit as it goes. And then when we started the graduate program, there was it was a challenge because we had an undergraduate chair and a graduate chair, and we were trying to figure out how to bring the department really together and to think about how we are sort of one versus kind of two silos. And so we put a proposal forward to have more of a dean level position for nursing, and that was approved by the provost and the academic dean at that time. And so then now the position is called chief nursing officer. So I've been officially in that position since May, so not that long.
It's still very, very new, but it
Very
is
new.
But as somebody who's worked closely with both undergraduate and graduate, it is great to have somebody who sort of understands the depth and breadth of what we're doing. And we're so glad you're here to tell us more about that.
Yeah, you're so right. I mean, even thinking about, we do a lot of cross teaching in the department.
Mhm.
We have some doctorally prepared faculty who teach in the graduate programs. And so it was always kind of like, where do they fit? And so this really it provides a little bit more of a coordinated umbrella for the department. So it's been a really good move for us.
And we made a really intentional decision to this isn't a school of nursing. It truly is our nursing department.
Mhm.
It's part, as we sort of think about the future, it allows us to be more nimble and sort of evolve as appropriate as we sort of think of through these things too, which I think has been a really thoughtful way that we've thought about the program. So I'm excited to see where your role takes us.
Yeah, exactly. And also it sort of created an environment. We have an undergraduate chair, Nicole Lang, who is amazing.
She was the clinical director before, or did a lot of clinical stuff, or no?
She taught in our leadership series. So she has this skill set that's just perfect for that leadership role. And then Jennifer, who's the chair of the graduate program. And so now it sort of feels like we kind of have this nice three-legged leadership team that, and we really can kind of go to. It's been really a good move all around.
That's great. It's always better to feel like you're in it with everybody else. And I think,
Yes.
and healthcare is really a team sport. So
Yes.
it's really appropriate, I think.
Yeah.
So let's kind of go back a little bit. Tell us about the history of nursing at St. Ben's. When did the program start? Don't have to be specific with everything, but tell us how how nursing became such a pillar for us here at St. Ben's.
Yeah. So, that's a great question. And I don't want to misspeak or misrepresent, but my understanding is the program basically was designed in the late 1960s, and we started with the first class who came into the nursing program, I believe, in 1971, and then they graduated in 1973. So if you do the math on that, we've been in business. I think we'll be graduating our 53rd class, I think, coming up in the class of 2026. And so also, if you do the math on when I started, I've been teaching for 27 years. So I've been here for just over half of the time that we've been here. The school or the kind of the school itself, like I said, graduated its first class in 1973. And so just kind of over the years, I think we must have close to 2,700 alums from the program. So if you're listening and you're one of those alums, thank you for tuning in, and hopefully we can kind of share with you some of the changes that have happened over time. Some of the things, kind of the sisters are still very, very involved, and I know they were from the beginning. And the sisters still have a very kind of ritualistic relationship with the nursing program. So they still are very involved in our pledge ceremony, which is welcoming our new students. They're also very involved in our pinning ceremony, which is for our graduating students. So even
those
though
typically take place at Sacred Heart, if I remember.
Yes, BAC for pinning we do, but the sisters will come and do a hand blessing at that point, and also for the pledge ceremony, they will bless the stethoscopes for the students. So obviously, with the Benedictine mantra of listening with the ear of your heart, that's a pretty important element, and has been from the beginning, and now kind of remains still strong.
Speaking of the sisters, and we've had this conversation before too, but I think probably on St. Ben's at home, but that connection between the college and St. Code Hospital, I always tell people who ask that we're siblings. So why don't you tell us a little bit more about that familiar relationship between the college and the sisters and the hospital?
Yeah, I think my understanding of that, the sisters came to this area, they saw a need for healthcare and education, and they started the St. Cloud Hospital, and we still have our students at the St. Cloud Hospital for a large percentage of their clinical experiences. And so you just think about how that really wouldn't have been possible without the pioneering work that they did. And I think it's well known that they sold the St. Cloud Hospital for $1. I know.
$1. Can you imagine? $1.
I know.
Yeah. So 1961, I believe. Or 1962, I think it was finalized. So it was at the time they knew the hospital needed to be separate from the monastery. I mean, even at that time, I think the liability of healthcare was probably a little more than they could manage, and wanted it to be able to be free and kind of do its thing that it needed to do. And then also they thought maybe it's time for the college as well. So they sort of went through that incorporation process at that time. So it took a little less time with the college, 61, and I think 62 was the hospital. And rumor has it, this legend has it, I shouldn't say rumor, but even the hospital was started, the city did not, no one thought it was necessary. Nobody needed a hospital until there was that huge tornado in Sauk Rapids. And they were like, okay, we need a hospital too. So
yeah. And I also think it's fairly visionary, of the sister nurses who, I imagine were very instrumental in starting a baccalaureate program in nursing. Like that was very rare, kind of when you think about in the early 70s, a lot of nursing education was done in hospitals. So there was a parallel diploma program in nursing at the St. Cloud Hospital, which I think continued until around 1984, kind of into the 80s. So really at the same time, the sisters are sort of starting a hospital, kind of running a diploma program in nursing, and then kind of having so much sort of forethought to think about what baccalaureate education could look like for nursing too. And so it's actually pretty remarkable, those foundations that they set.
They always have that sort of vision for leadership, that intentionality, what it means to be truly, I think, not just a student of the medicine or sort of the body, but also of the mind and the spirit, kind of collectively, which I think has always sort of set programs like ours apart, really, from others, for sure.
Yeah. Then they've just stood the test of time, for sure.
So let's kind of move into the modern day. So we continue to partner out in the world and giving our students real hands-on experience. So we are a baccalaureate program, but they're still getting real world experience. So how did today's students get to experience some of the high impact practices like study abroad, undergraduate research, and other opportunities when nursing requirements are so rigorous?
Yeah, I mean, it takes a lot of effort, and my current colleagues, are working dutifully behind the scenes. When you think about study abroad, we've maintained a study abroad program in nursing for decades now. I think I can say, and we've done it by embedding it, I think, into the requirements. So currently, our students are going to Zambia in the fall and Costa Rica in the spring. They also can participate in the embedded programs at the college level. So we've just really made a commitment, I think, to certain pieces, and certainly study abroad. And so Rochelle Larson, Mary Zelnick have been really instrumental in kind of keeping that flame going, even though it takes a lot of work and a lot of coordination, working with community partners here and abroad, just to think about that sustainability. And really, I mean, it's just very Benedictine to be stable. And so when we start new programs like that, I think we always try to keep the long view in mind. As far as student research, I mean, that again, we try to kind of create partnerships with students. Faculty often will have the idea for the project and then solicit solicit the students' assistance in some part of that project. And students are always so willing here. I think we're really, really lucky. We've always had a great students who are willing to kind of raise their hand and come forward. And so a lot of good undergraduate research, and just the experiential part, that's a no-brainer for us. I mean, we're always doing experiential, whether it's simulation or clinical experiences, and expanding the scope of where and how we're doing those things. And then now kind of the whole idea about technology. So integrating technology, high fidelity simulation, but also kind of how can we work with artificial intelligence in doing our work better, and how can we increase our simulation experiences through like virtual reality. So we currently have 2 faculty who are going on sabbatical in the spring, who are really gonna do a deep dive into some of those innovative kind of high technology types of experiences that we can then kind of make it an even better learning environment for the students.
Well, and I think with those, I think there's the first reaction for some who maybe are a little bit more skeptical about virtual reality or some of this technology is that, what we do is so human and humane.
Mm-hmm.
But what I've learned from sort of working with you, there is something to be said to be able to do a simulation that feels real without the potential harm to an actual patient. And I don't mean like physical. I mean, like sometimes these things can be very deeply traumatic in these experiences, or they happen in contexts that we wouldn't necessarily be appropriate for a student to have. But for them to experience that for the first time in a virtual setting before they're faced with it in real life is really, that's an advantage.
Definitely. I mean, there's definitely a safety element to it. And there's also just a accessibility element to it. It's not always possible for us to create, common learning experiences for the students. And so we can do that through standardized patients and standardized simulation experiences where the students can have this experience and we don't always have to say like, well, we can't do that because we don't have that environment. And like one example of that in the public health world is we do a pretty expansive poverty simulation.
Yeah.
Again, Mary and Rochelle are instrumental in it, where our students can go through sort of a day or a month in the life of what it's like to live in poverty. That's not really something that you can just do in the real world. So, or a disaster simulation. They do another disaster simulation that is just very, very real. And I think it gives the future nurse the ability to, again, make the mistakes that they don't make then once they get out into practice.
Yeah. So tell us how, with some of these clinical experiences that when they're actually able to do real world experiences, how do you or your colleagues create those partnerships that make clinical placements possible?
Yeah, I think it's just a very personal or interpersonal reaching out. And we have had very good success with hiring nurses from the community who are well connected, and that always helps too. So it's really just a lot of outreach, a lot of cultivation of relationships, and really sustainability of those relationships. I think they see us as we've been here for a long time, we're kind of in this for the long haul, and really a very accountable group of people that I work with too. They're not really those who will have an idea and let someone else do the work. I mean, they're just a bunch of nursing faculty who really dig in and work hard and value those relationships. And some recent examples, again, I mentioned the disaster simulation. So even working with EMTs, active EMTs to come in who can really kind of give their real world experiences.
Yeah.
And to do a simulation like that, you can't run it without a large group of people. So you need victims, you need, I actually play a role in that as the reporter. So so I interrupt and try to interview.
Getting in the way.
I do get in the way and try to interview the victims and, try to reveal their identities and that sort of thing. So it takes a village, of course. And I think cultivating those community partners has been essential. And we do it every day. We're still doing it. We're still working and still trying to grow our connections.
So how is the curriculum changing and what does that mean for today's students?
Yeah, the professional organization, the AACN, so the American Association of Colleges of Nursing, has been driving the whole idea of competency-based learning. So we are sort of going with that, and so really our curriculum is changing to focus on competencies and sort of sub-competencies. So that has been a huge undertaking, just making sure that the curriculum evolves with sort of that approach. So that has required, major and minor kind of new courses and tweaking to current courses. But interestingly, the curricular model that we currently have, which is based on the levels of prevention, so and a primary prevention in the sophomore year and secondary and tertiary, kind of as the student goes through, has been pretty stable, which is interesting.
Yeah.
I think when you have a good design can stand the test of time, I think that's always a good thing. But really kind of the biggest change in the curriculum has been the competency integration driven by the professional organization.
And I can see then how simulation and community partnerships and clinical experience would be so important in that, to be able to demonstrate that you understand how to do that, that you're competent in that particular element, understanding. It's not just test taking, it's some of that, but it's also there's a whole host of ways we evaluate competency then.
Yeah. And I think really a huge emphasis on sort of leadership. And I think it's surprising to our students and how much the nurse needs to know and do outside of kind of the basic things of what you might see when you're a patient in the hospital. And, you think, oh, the nurse has to know how to start my IV and they have to know how to take my vital signs and they have to know how to give me a medication. And it really, the competencies are pushing us to think about how do we teach students how to manage populations, like how to do these sort of bigger ideas, I guess, concepts, and think a little bit more critically, think more efficiently and quickly. And so, yeah, it's ever changing and ever demanding.
Yeah, and the role of the nurse leader, I can see absolutely if you're the one changing the IVs, you're also probably likely the first person to identify a pattern.
Exactly.
That's coming through your clinical site, whatever that is.
Yeah, exactly. Seeing patterns and then also thinking about the patient sort of beyond the hospital and what brought them here and kind of what are the social determinants of health and how do they play into the whole patient experience. And so I think that is the nurse, the nurse of tomorrow is really one that thinks even more broadly and more holistically about the patient and can be sort of flexibly moving between care environments because that's really what people need.
The goal is for folks to be healthier. And so it doesn't, just that you handed somebody a script and say, go on your way. Like if there are factors that are making it impossible for them to follow, then that's the key. That's the thing we have to get past, right?
Yeah.
It doesn't matter. Like we can have all the tools, bells and whistles, all of that in the world, but if the patient accomplish, understand, utilize, pay for it, whatever it is, it doesn't matter, right?
Yeah.
At the end of the day.
Exactly. And I think, one of the newer initiatives is the Salem Clinic, which that's really kind of where some of that idea comes from. It's about how could we get out into the community and create partnerships. And these were ideas that, I think at its core, I think Jennifer Peterson as director of the graduate program was thinking, how can we create a faculty-led clinic where we can have practitioners and we can have nursing students kind of come together in a coordinated way to serve the needs of a community. So the partnerships there are very broad, and I know you've been really, really involved in that as well. And
It's my other duties as assigned.
Yeah,
I don't know.
yeah, it makes you an honorary nursing faculty. But even thinking about working with churches and the police department and community service agencies and social services and the Public Safety Foundation, just like how that really is the direction that we need to be moving in.
For those who might not know, we'll kind of like just a little bit of a digression into the clinic. So we've done a fair amount of publicizing about it. So check the website, check a magazine. I'm sure there's a lot of examples, but it was an initiative that kind of started through the Public Safety Foundation, as you mentioned, but also a lot of nursing faculty have been talking and thinking about that for a long time. Like, what would it be to be able to run a clinic themselves? We always sort of think about that. People always ask us, like, "Oh, do you see patients? Would that be a great way to train nurses?" Yes, it would. But we are in a healthcare provider. And so several years ago, somebody called me and just said, like, could we make this happen? Would St. Ben's want to be involved, or your nurses? And the first thing we said is we don't want to all of a sudden become a healthcare provider. Like, that's not core to mission. We have to think really carefully about what our mission is, but we're interested and everyone wants it, right? That was sort of the key. CentraCare got the same call. Like, would you be interested? And they're like, yes, but it was pandemic. I mean, we were still really heavy in the consequences of the pandemic and the challenges for workforce. People were stretched so thin. Nobody had extra staff. We had willing nurses and nurse leaders, and a need for those opportunities. They're a health system and have a need for this kind of offering. And the Public Safety Foundation, why they were invited to ask, is they have these community outposts around as a model that was based in Racine, and they kind of look at what were some of the social determinants of crime or calls to police. And in this particular part of St. Cloud, has the lowest health outcomes of the entire region. Most frequent flyers to the emergency department. Almost all of the calls are mental health related, but also have other underlying health conditions sort of wrapped up into all of that. And the St. Cloud PD is pretty innovative, and they have a community response team that's a combination of a police officer, a uniformed police officer, a social worker, and an EMT. Because every person in crisis might have a different thing that's causing a different experience with what level of the system, and might be more willing to talk to a healthcare provider. Or maybe a police officer, because actually what they don't want is meds. It just depends, right? I mean, it's a really interesting question about it's a really innovative way to meet need. But they themselves were like, we're not healthcare providers, and none of the folks involved are able to provide even acute care. The EMTs, it's even more acute than acute. I mean, really, they're just there to make sure it's sort of in transit, the wheels don't come off. And so, when they asked the community, they went out into the community. Actually, it was our nurses, as my understanding, it was our nursing students and nursing faculty who did some of the research within the community, focus groups, and surveys to find out what the community needed. And they said healthcare, but they also said food, jobs, support, assistance. And so the idea of making this outpost health focused, but with a focus on the social determinants of health, would be the goal. And we've been working on it for years. It's up and running. It's right now open 1 day a week with our graduate nursing faculty. And our undergraduate nurses are doing some of the things they were doing already around preventative healthcare. You were talking about kind of the primary, secondary, tertiary. Mm-hmm. So it's a really remarkable model, and I'm just proud to be involved even remotely.
Yeah, and I haven't been directly involved in it, just sort of peripherally, and some of my role has been really trying to support our faculty who are kind of working their little tails off to get this going. And there are things that, it takes a lot of work, and it takes a lot of time, and it takes a lot of energy. And when you try to interface sort of healthcare and higher education, you find like, Well, higher education isn't necessarily going to staff for something like that. We have courses that we need to teach. So just really wanted a big kind of have a second to shout out to the faculty who've been just giving their hearts and souls to kind of this clinic. And
they're
it's
truly
just been
volunteers.
great.
I mean,
Yeah.
really, they are like,
Mhm.
they're formally and officially volunteers of Center Care and St. Cloud Hospital's Project Heal
Yeah.
while they're in these spaces, and then also bringing in students, precepting them as they get experience for their FNP. I mean, it is remarkable.
Yeah, it does. It's meeting a lot of needs, not only for the community, but for the experiences, certainly. The other kind of newer initiative, kind of backing to the undergraduate, is there's really been a growing emphasis on end of life care. And that has been that's been another example actually of how we've been able to bring the undergraduate and graduate programs together. One of our current nursing faculty just recently received a fellowship in thanatology, which is about kind of end of life care. And it's just, and we have award-winning posters that have been presented nationally. So this has been another initiative, just really trying to sort of create experiences for our students to be more effective at end of life care, and adding a sort of a ethnic and cultural diversity to that, again, in a simulated setting, because we don't always have access to people who happen to be dying at the time that our students are available to be in that experience. So again, just another really good example, I think, of how the program is growing and expanding and trying to meet the needs of the community more effectively.
We've received several grants for that work too, I know. And I think really what is more Benedictine, that idea of sort of, I mean, truly like keeping death sort of ever present, ever before our eyes. I mean, that it is a huge part of the work that nurses can and will do. And I think what a privilege and honor it is to be with folks and navigating through that, but to have experience with it, to do it in a really thoughtful way, really appropriate way, I think is really meaningful. And I know you've worked with, my understanding, if I remember correctly, you've worked with elders, the Native American community, as well as Somali elders. Is that true? Or I can't remember specifically that part.
Yes, I believe so. Yeah, and continuing to kind of think about that and grow that in terms of what would be the most impactful experiences for the students. So some really good outcomes so far, and just continued work.
It's incredible.
Yeah, it's fun to watch.
So let's see here. Let's kind of shift a little bit into the sort of what we're thinking about, sort of how we're continuing to grow nurse leaders. So let's talk a little bit about the 4+1 program. What's the value and benefit of a program like this? And what are some of our current graduates from this program doing now?
Yeah, that also is a good question. So the 4+1 is, the idea is that you do your first 4 years kind of undergrad, and then in the 4th year, you're starting in some graduate courses, so that by your end of your +1 year, you would have a master's degree. So this, because we started a graduate program and we had an MSN program, we thought it would be another way to kind of expand and sort of recruit students into graduate education. We actually just met with our advisory committee this week to sort of get some feedback about that program and see if they saw a need for it, and how it could, again, better sort of serve the profession. The idea, our 4+1 or our MSN in general, which would include the 4+1 program, is focused on education and leadership for practice. So that sentence basically means we want our students to become educators, so gaining a graduate degree to become a nurse educator, say kind of like my role, and leaders, so that could be in a clinical setting, it could be in a community-based setting, hospital setting, and for practice. So they're expanding their practice. They're becoming more expert in a clinical area so that they can become a leader or an educator in that area. And So in the 4+1, the students take some of the graduate core in that last year alongside their undergraduate. Yes, so their fourth undergraduate year, they're taking some graduate courses, and then they take their licensure exam, pass their licensure exam, and then they just roll right into the
Are they working
finishing
usually
up.
at the same time in that fifth
Usually
year?
they will be employed. They will be looking for employment. They will be starting a new job. It's a challenge, as you can imagine. You're trying to pass your exam, start a new job, and finish your graduate education. But, in a Benedictine way, I mean, we're just very sensitive to that and try to support those students kind of through that transition. The outcomes of that program, students are becoming leaders in their respective positions, so as they grow in their position. We have had students who have been offered full-time tenure track, faculty positions coming out of that
right out
program,
of
right out of
incredible.
the gate. I mean, there's a need for that. There's a need for really good leaders who, have deeper clinical experiences and education. And just most recently, we got a message from one of our graduates from the MSN, the Master of Science in Nursing, who interviewed for and received a position at Children's as their operating room supervisor. So kind of new grads just going out and doing sort of amazing things, and great feedback from the interviewing team, who said that, this was an amazing interview, an amazing person. And, so I think it's the value of the program is it's a very, big launch into a career, particularly if you're thinking that you want to be a leader, focus on leadership and education.
Yeah, I mean, there are distinctions between sort of individual performers setting, right, and those who are interested in systems thinking, leadership, supervising, some of those as well. So to be able to identify some of those students who have that interest early on, I think is a real benefit to them as well.
It is, and it's there's some financial benefit to it as well. Just thinking about our students who are in that fourth year, they're getting graduate level courses, which are could be transferable courses, and they're paying their regular undergraduate tuition. So it's kind of, I hope that more students do take advantage of it. I think we currently have 5 students that are sort of in the program now, 5 or 6.
Number.
Yeah, and that is, the capacity is, I would say, about 8 students, that we could accommodate. So we're getting close to that capacity. But when I was talking to my advisees about it, it's like, if you're at the least bit interested, I mean, it's a very low stakes way of seeing if graduate education is for you, and to sort of give yourself a little bit of that experience. So,
well, I mean, lest anyone have any doubt about the success of our program, I mean, why don't you share a little bit about the demographics too? So what's the standard cohort size? Who are top employers? What are our NCLEX pass rates?
For the undergraduate program? So we take 72 students for each cohort. So
and that's expanded somewhat recently. It's been a while now, but.
Yeah, so we were at 54 students, and we expanded, I want to say 2 years ago, we expanded the cohort size to 72. And so so they have 1 year of prerequisite courses, then we accept them at the end of their first year, and then they have 3 years of courses with us. So 72 students. The pass rates have been, as usual, I mean, they're in the 90s, 90%, 90 to 95 is a pretty predictable range for our students in terms of the NCLEX pass rates. And top employers, I mean, they're kind of all over wherever you hire nurses. CentraCare clearly is a significant employer for our students. But then Regions, HCMC, they're in the Fairview system, they're in the Lina system. So we see, I actually, in preparation for this question, I did look at the last couple years of kind of alum employment kind of statistics, and it was
So diffused.
Yeah, it was just everywhere. So
They do kind of get their pick of the, they get the kind of their pick of the litter. They get to choose really where
yeah,
they want to be.
we do get a lot of positive feedback from employers in that regard, and kind of some of the themes, again, with the advisory committee that I mentioned, that is representative of some of our employers. And the feedback is pretty consistently, they think at a higher level. They're more accountable. They're very responsible. So it's just been it's just a pleasure. I mean, it's very easy to work with our students because they do tend to be really very good employees, as well as good of employees as they were students.
So what about placement rates? I mean, do our nursing grads have any trouble getting jobs?
Not that I've ever heard of. Some will choose to go right into volunteer service, but for the most part, full-time employment is happening. Some are getting offers in February, March, and some of them from their internship placements, from their capstone placements. So yes, there's still a need for nurses, and our students don't seem to be having difficulty getting their first or second choice in employment.
And this is not a St. Ben's only program by any means. So how many Johnnies do we have typically in our program?
Yeah, it varies by year. The average is probably about 10%. So in a cohort of 72, you generally have about 7 students who will be St. John's.
Do you have any sense of sort of what it is compared to national average? I mean, I actually
that is about the national
Okay.
average. It probably is. It's kind of riding right along with the national average. So not any higher, not any lower. It's interesting, kind of when I talk to the Johnnies about sort of what brought them to nursing, a lot of times they have a family member who is a nurse, one of their parents, and so that's always kind of nice. It's positive, that they coming from those role models into the program. So for sure.
So let's kind of shift a little bit to graduate nursing. We talked a little bit about it with the 4+1 and the graduate and clinic as well. But what's the origin story of the nursing program? How did this all come to be?
That I love that because it started probably longer ago than many. When we did our renovation of the facility and we were kind of working with donors and trying to cultivate kind of relationships and sort of do that facility, the talk about graduate education was coming up then. It was kind of in a time of transition, and it takes a lot of, I think, courage at that time to make a shift like that. So it was sort of always in the back of our minds. So probably for the last decade, 15 years, we've really been sort of thinking about, is there a place? And I think the reason for that is because we've done very well with undergraduate education. So if you take that quality and you translate it, and there's a significant nursing faculty shortage. And so some of it is self-serving, right? Like if you can
grow your own,
if you can grow your own, then it really helps. It helps everybody, right? The more graduate prepared nurses we have, it helps everybody. And so more seriously though, when Barb May was the dean and Mary Hinton was the president, they started to get a little bit more serious about the idea, and they started really thinking about how we could make this happen here. And if you think about what it takes to start a graduate program, I mean, it takes feasibility. So can you actually make it happen? It takes money. You have to actually have the funds to do it. And it takes the right people, because you can't start a graduate program without qualified faculty.
They have to be doctorally trained.
Trained, and depending on your program, particularly in the nurse practitioner paths, you have to have a practicing nurse practitioner.
Currently practicing. That's what people don't understand, is our nurse faculty are actually working right now, along with being full-time faculty.
Yes. So there's like all these ingredients, and you have to be willing and able to make a change in mission, which that's we're really, the hardest thing.
We're not necessarily, we believe really strongly in our mission.
Yes. Because right now the mission, or previously the mission was, undergraduate, residential, liberal arts, Catholic and Benedictine. So that's the foundation, right? So you can't have a program if that's your mission. So all of those ingredients needed to happen. And so the ingredients were basically leadership who were willing to explore it. I believe a donor who was willing to fund feasibility.
Yep.
And the feasibility showed, if you start a graduate program, they will come. It helped point us in the direction of the FNP as a very viable
That's family nurse
program.
practitioner.
Yep, family nurse practitioner program. There were other programs too that had a lot of equal possibilities. We were kind of trying to start in a way that we knew it could be sustainable, and where we knew that if we started with that, perhaps we could grow kind of other programs and other branches along the way. And the MSN, again, a kind of a little bit of self-serving. We knew we could have this core group of courses, and we could have MSN students and doctoral students in it. And then the DNP, so the Doctorate of Nursing Practice, which is a terminal degree in nursing, which it's a practice degree. So it's different from a PhD in nursing, which would be more of a research-focused degree. We thought a leadership focus for a doctorally prepared nurse would also be in good alignment with kind of what we do well here. So, it was probably right around the time 4 years ago, 5 years ago, that the feasibility was done. It seemed like it would work. We had Jennifer Peterson in place already as a full-time undergraduate faculty member who was an FNP, is an FNP. So we had like all the right ingredients for coming to basically gave us the green light. The administration gave us the green light, and Carie Hoover and Jennifer Peterson put the curriculum together. It was like
it's remarkably fast.
time.
Like anyone who would ever criticize higher ed for moving slowly has not seen our nursing faculty work.
No, it was
really
it
remarkable.
was record time, and with just kind of their four hands, they sort of put it together, and then it had to be obviously accredited. So through all the accreditation, and COVID happened in there too, just
small things,
little thing
small
called
things,
COVID. Yeah. But just, it feels like this year we've sort of just been like, oh, wow,
we did that.
we did that.
And we're still doing it.
It went from idea to reality in probably 2 years.
Yeah,
which
and I'm a
is
place
very fast.
where people sort of speak well about you all behind your back. They'll tell me sort of reputationally the number of healthcare leaders, community leaders who've said to me like how impressed they are with the speed, the quality, the pace. I mean, just, again, it speaks so well of everyone involved. And, truly, like Carie Hoover was like back in COVID wings, like practicing during the midst of the whole thing too, right?
Yes. Went back into clinical practice.
Continuing to do, it's really quite something.
It really is. And just a lot of hurdles to go through, but they just did everything. And so then, as graduated our first graduate from in 2023, Denise Christie, who was graduated from our program in 2000, who I had as an undergrad, and remember fondly, and really kind of took a leap. And Denise, she was just in California. I just talked to her. So if you're back from California, welcome home. And just thank you for taking the leap of faith. She did the DNP in leadership.
Yeah. And tell us a little bit more about that. I think you talked about it a little bit, but what would a DNP in leadership, what could they do for a living?
It really, the intent is that you're focused on executive leadership. And so Denise, who is a practicing certified registered nurse anesthetist, which she had been doing for 15-ish years, wanted to sort of take her career to a level where she could be in a leadership role. And so developing skills in not only like conflict management, transformation, change management, but budget management and all of those kinds of skills. And so she's currently still practicing as a CRNA, to my understanding, and also is facilitating as a leader some of the clinical experiences for CRNAs and for our advanced practice providers, our family nurse practitioner students. She's just been at Center Care as sort of one of the foundational people who is really making those connections happen. And also just shortly after she, or as close to finishing her program, was asked to serve on the board of directors, which is just a crazy thing. Like the only advanced practice provider, to my understanding, that serves on that board, and really I think is set to make some really great positive changes just in the community and in the St. Cloud Hospital and in the Center Care system. And so anyhow, super proud of her. I can't say enough good things. And she does teach for our program as well, which is great. So we're happy to have her back and in any capacity that we can.
It's fantastic. I think as you know, I think as we watch healthcare change and sort of the needs of healthcare changing, you know, there was a time where really truly there were sort of only MDs and MBAs, you know, sort of running hospital system, healthcare systems. And we're seeing a change and a desire for more nurse leaders in those roles too. I mean, we've seen nurse leadership forever, really, since, you know, since the beginning, but now we're seeing it in those administrative spaces, which is so important. And I know that one of our trustees, and who was an advisor and kind of a thought partner as we brought on, is a DMP herself, Joy Plowman, who is the senior vice president and president of the of Center Care at large, and also president of the St. Cloud Hospital, and is a huge champion of our program and a mentor to many of the students.
Yes, exactly. Yeah, just an amazing role model, and just really has the best of everything, kind of that nursing approach, leadership skills, and that, just very happy to be working with Joy also in any capacity.
And so many of our Benny nurses have gone out to seek these graduate degrees at other institutions. I love that they can come back and take it from us. It's a hybrid program, is my understanding.
Yeah, so the idea is that most of the courses are online, and the students they're also on campus. Generally about once a month, they'll come to campus to get that sort of Benedictine community, and then to do, you know, for the family nurse practitioner students, some of those hands-on things that are a little bit harder to do online. But we've really committed to a couple of things with our students. One that we would keep it as a hybrid program, so they'd always have the ability to sort of come to campus to do hands-on and to experience community, and also the commitment to fostering the
clinical
placement
sites for those clinical,
which
is a big deal.
That is a big deal, and that is a lot of work as well. And I know, you know, again, kind of Jennifer Peterson, I know Mary Larson and Mary Pesch, the three main faculty who are teaching, and Carrie Hoover as well, our four main faculty teaching in the graduate programs full time, have just been doing a ton of work to make sure we have really good quality clinical experiences for their students. That sets the program apart, because a lot of your online
that emotional
nationals
labor of
don't have
having
that.
to do that mental load. I mean, we're really taking a lot on for them,
Yes.
and it's I know it's no small feat by any means.
Right, and we've had students that have come back and said that, you know, and that have transferred to us after trying some of the online national programs. It's really hard to find your own clinical placement site as an advanced practice provider, and so, or student. So that's one of the signature things I wanted to make sure that I mentioned it, to really kind of honor those faculty who've worked so hard to get it done.
So just quickly, if you, what are some of the statistics, like the need? I mean, we don't bring programs on unless there's a need. That's clearly what. So tell me sort of what the need is for these kind of advanced practice nurses.
Yeah, you know, I think particularly in kind of underserved rural communities, the need for nurse practitioners who are able to kind of treat common, chronic, and acute illnesses is essential. It's really sort of filling really a significant need, I think, in rural communities in particular. And I just kind of did a little peek at sort of what the ratio of NPs versus MDs about. It's about 50-50 in nationally, MDs versus NPs and PAs if we put advanced practice together. So they're really filling a significant part of the healthcare community. The other kind of, as we think about the future of that program, we've sort of created this solid foundation of a core, like what we would call a graduate core, which gives us the ability to sort of think about, would we want to do any certificate programs? For example, our FNPs that go out into practice, one thing that we're hearing is that they see a lot of mental health things, and
It's
that's
on
not
my
a
list of
surprise.
things,
It's not
yep.
a surprise. Yeah.
Yep.
And so, can we take our DNP core and can we launch a certificate program, say in psychiatric mental health, and other big areas in acute, adult acute, and gero, sort of the hospital level, because that it seems to be where our FNP graduates are finding positions in more of acute care settings. They can, and so can we have a certificate
Prepare
that
them a little better for that,
qualifies them
yeah.
for that? Yeah.
Yeah.
So just the sky's the limit with that. I think from a strategic planning perspective, we're starting to have those conversations now about if we're going to launch, where might we go?
I think we've got one audience question. We'll take a quick break for that before we wrap up here.
Yeah, so it comes from Stacy, class of 2009. And Stacy is wondering, how can our alumni and the broader St. Ben's community support or stay connected to the nursing program's continued success?
Well, hi, Stacy. Thanks for that question. I think there are, I really think, depending on where you're at, I think precepting our students is just a really key way of staying connected to the program, saying yes to that. I know we ask a lot of our preceptors, and if you're willing and your organization doesn't currently have our students there, I think advocating for St. Ben St. John's to come into your facility would be a really, really mutually beneficial way. And also, I think, just letting us know that you're interested. If you would like to do a one-on-one mentorship, I mean, we're always open to kind of connecting our alums with current students, particularly if you have a certain area that you're interested in, that we could make a connection with your students. And I mean, I'm sitting with institutional advancement here. Giving to the program financially is always a wonderful way. We have what we call a gift account, an unrestricted gift account, and just to kind of tell you about a way that we're kind of using some of those current donations. If you're someone who gives regularly to the program, you're like, what do they do with this money? I don't even know. Because it's unrestricted, we can use it for a variety of different ways. And one of the ways we just got approved by our executive committee to use that gift account is to bring a reflective consultation on board to work with our faculty to learn how to be more reflective teachers. And what the research shows with that is the more reflective we are as teachers, the more resilient our students will become. And if you're kind of a person who's in a position to hire our students, please hire them. But know that I think what our employers are looking for is more resilient nurses to come into the workforce. So we're doing everything we can to sort of create the most resilient nurse that we can. Coming off post-COVID, that's become even more important. So anyhow, giving to the department is one way of, as an alum, of kind of not only giving back to the department, but expanding and kind of growing students who I think will be your colleagues, soon.
tap future nurses on the shoulder and say you think that St. Ben's, St. John's would be a great place for them, either undergraduate or graduate for sure.
Right.
Well, thank you, Carie, so
Yeah.
much for an informative and inspiring conversation today. You brought a wealth of information. We covered a ton of topics, and this hour went by so fast. Thank you for the work you do to support St. Ben's nursing, each and every student, and the health of our entire community. We really appreciate you, Carie.
Well, and thank you too, Heather. I know that you're kind of our honorary nurse, right? You've just always had our back too. And so I just feel like we can't do half of what we do without the financial resources that you somehow find and somehow bring to us. So thank you.
Thank you. Well, audience, it's really about you. You are the ones who make this possible for all of us here. So thank you for taking an hour out of your time to be with us today.
And thanks, Stacy, for your good question.
Thank you again, Carie and Heather, for your time today. Audience, you can share additional questions or comments on today's episode through the evaluation form that will be emailed to you from the Alumni Relations Office tomorrow. This concludes today's episode of St. Ben's at Home. Please check out all our past episodes on our website, and we will be back with our next episode in 2026. Thank you all for attending, and happy holidays.